everyone. Welcome to the Glow podcast. I am here today with a very exciting guest. I have Garrett from Vivid Pathology, and I'm super excited to talk to him. But if you are new here, we are Tailored Marketing, and we partner with organizations in healthcare, longevity, and the wellness space to fuel growth through strategic marketing and sales strategies. So if you are interested, drop a comment below. Garrett, thank you so much for coming on today. I'm really excited to have you here. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Sure. I'm Garrett from Vivid Pathology. I'm the CEO, and just a quick fact about us, we've actually been running since the 60s. 3 generations worth of families are running our practice. So a lovely little pathology practice in Pensacola, Florida.
That is awesome. We love a family business. That is so cool. And like you said, since the 60s, about 65 years now, that is awesome to be in business for that long. You've made it through definitely all the humps and challenges.
Several.
Yeah, I'm sure. And so for anyone who's kind of not familiar with pathology, with Vivid Pathology too specifically, can you just tell us like a little bit more about kind of what you guys do over there and what is your process and kind of how you work with people?
Sure. So our primary focus, a big overview, diagnosing cancer. Like that's the main theme of what we're doing, to make it as simplistic as possible. For those of you out there that have any skin shave at a dermatologist or a biopsy taken, basically we take it from the ORs and from those practices, and we get it into a glass slide for our pathologist to actually look at your cells and determine whether or not that is cancer. So that's our big theme. That's what we do mainly.
Awesome. Yeah, and so you all do everything kind of from end to end, like besides actually, like you said, being the dermatologist in the office, but you are the ones who are taking the sample, diagnosing it, and then kind of getting the results back to patients.
Yes. Our doctors work hand in hand with those providers. We don't have the meetings. We'll consult as needed, but we get the results back to those providers so they can have those conversations with the patient.
Yeah, that's awesome. And that's something that people, are so familiar with because, I mean, I'm sure, especially in Florida, there are a lot of people who are having to kind of get, those skin shavings, like you said, or get maybe something cut off and stitched back up. So I think that that's something that majority of the population is very familiar with.
Yes, especially in Florida, lots of sun, lots of dermatologists in Florida.
Yeah, no, definitely. And so are most of the hospitals that you work with in Florida, or is it kind of throughout the US, or what does that kind of look like?
So we have a handful in Florida and mainly in the Panhandle, and then we actually have a lot of rural hospitals in Alabama that we service.
Okay.
Rural hospitals have a hard time having their own pathology lab. So we're of service to those people so they can send everything to us. We can process it. And we actually just opened up a branch in Birmingham, servicing a hospital in Birmingham.
That's awesome. That's super exciting then. You're definitely expanding. And so with you all, like you said in the beginning, being kind of a third generation pathology group, how does that kind of influence the vision that you as CEO have for the company?
Yeah, so this is always our focus, which is we want to match those big name providers, your Quests and your LabCorps. We want to match their availability of service. What can we offer you with a hometown concierge style feel? So our pathologists have no problems calling patients one-on-one and explaining issues with their results. Like if they're asking questions above and beyond maybe that their individual provider can't answer, on the phone with them and work with them. We have a few tailor-made testing options for pathologists locally, right? So they'll talk with our doctors and say, hey, I want these tests run and I want these tests added on specifically for my patients. And it might be one provider in a set of 20 providers, but we're going to do that for them because, we're we want that hometown feel to stay with Vivid, no matter how big Vivid really gets.
Yeah, no, that's awesome. I feel like that's so important too. Like when you are doing business with somebody, and especially business as important as, like you said, diagnosing cancer, like you want to have almost that more of that personal touch, because it definitely adds something to the experience when you are dealing with something so personal. And so I think that that's really important. And I think that that's something that often does get lost in something as big as healthcare. You feel like you're almost just another number, you know?
Yeah. And I agree. And we really try to drive that home here. I think people do get lost, but what's missed mostly by most organizations that get too big is a cancer diagnosis, no matter how big or small, is life changing for the person receiving that.
Yeah.
So I can kind of tout our staff here. They're really, really good about taking care of every single patient. We
Yeah.
have patients here. I know they're specimens, that's what we call them typically, but we know them as patients, right? And so that's our big thing, is treating them with the most care that we can provide.
Yeah. And would you say, like, compared to some of the other bigger organizations within pathology, that that is kind of one of the main differences in working with Vivid Pathology, or are there other things kind of where you set yourselves apart in this sector?
Absolutely. When you're dealing with us, you're getting somebody that's hands-on. I'm not going to put any names out there, but because we deal with
Yeah.
these groups too, we do get things that we can't service, that we have to send out the door,
Yeah.
and we deal with those groups, and it is very much a process. Um, a You're more of a client, or you're more of a customer than you are a patient when you call and try to get things done with those groups. And it's always
Yeah.
passed off to someone else. I'm like, here, we're going to take ownership of what's asked of us, and someone is going to be physically working on that to make sure that we get the answers that are needed.
Yeah. No, and I feel like that's like anyone that has dealt with the healthcare industry as a whole, like I'm sure that that's something that they're very, very familiar with, is kind of like anyone you're in contact with, whether it's sometimes even calling like the provider office or calling like your insurance company, like you get the whole workaround kind of like, okay, I'm going to pass you over to this person and then I'm going to pass you over to this person. And you're like, okay, like who do I need to talk to? Like, I don't know the intricacies of your business, you know?
Yeah. Yeah, it's very difficult. So, and that does get lost. And something I wish it was easier to push out to the world is that, the doctors are people. They're
Yeah.
treating as best they can. We might not have the systems and the processes perfected, but at the end of the day, like, they're there because they care about the people.
For sure. Yeah, no, definitely. Yeah, I think that that's super, super important. And so I guess like a little bit more kind of with your background as well. How did you kind of get started in pathology, healthcare in general as well?
So I was a county major, graduated, worked for a local bigger organization, independent practices. So
Okay.
that a group that had, probably 30 different independent practices underneath it. So I was essentially the financial manager of a subset of practices. So that's where I started. And then, I kind of consider myself pretty fortunate. My boss at the time was kind of grooming me for her role there. She moved over to Vivid at some point and then moved again. And, I got a phone call asking to interview at Vivid. And so that's kind of how I parlayed that into working for Vivid, and just been here over the past 7 years, working my way up and
Yeah.
to where I am now.
Awesome. And so for you as CEO with Vivid, kind of what is your vision for the future of Vivid over the next year or two?
Yeah, so our vision right now is to expand, but we don't want to expand quickly
Yeah.
because, again, we want to keep our feel, and then to partner up with some other pathology groups, and the target is kind of just far enough out of reach where they're servicing a different area.
Okay.
But we can also partner with them and collaborate on cancer diagnosis, and also be able to move work back and forth based on, how much work is getting done or how much work needs to be done. A quick overview of that arena, there's not enough pathologists out there right now to read
Okay.
the amount of work that's available. Smaller groups have a harder time because they either get overloaded or the work gets taken away by a large group that employs a huge amount of pathologists. So we want to be big enough that nobody can knock us around and we can hold our own and still keep that hometown feel.
Yeah, no, that's super cool. And so, what would the benefit be of like partnering with other pathologists? Would that be that they would be able to read kind of different things as compared to what you all can read in your specialists?
So we cover most all specialties here at Vivid.
Okay.
So we subspecialize. So anything that's a derm goes to a derm pathologist. Anything that's cytology goes to a cytopath. Like we make sure that all of our patients get the highest level of pathology that they can get from subspecialty. Adding another group lets us bring in more people to put a second eye on those cancer diagnoses. Or if you run into something that's very difficult, a lot of times a general pathologist will just send that straight out the door, send it to another big group, maybe like an MD Anderson or a UF Health because it's out of their scope. We can leverage those other groups first, which doesn't delay that turnaround time and us getting an answer or a result to the patient.
Yeah, no, that makes sense for sure. And I guess with you all being kind of a smaller pathology clinic compared to like some of the bigger names, like you've said, that most people are familiar with, what has kind of like been one of the biggest challenges with being smaller?
The biggest challenge, I think, is getting in with these major hospital networks or the major hospital administrations. You see a lot of merger and acquisition going on, big names buying up small hospitals that we're in. It's how do we get Vivid to the table?
Yeah.
Because they have all the big corporate connections with all of their vendors, but not necessarily Vivid. Nor
Yeah.
do they really know who we are. So that's probably the biggest hurdle for us is how do we get in the door with those people to let them know, hey, we're here. We can offer a lot more services than, just a typical single pathologist group. So
Yeah. No, that makes sense for sure. It's like really just like making these connections kind of and like, okay, this is what we can offer as compared to a smaller, just single pathologist, like you said, but also a larger group as well because you have a very specific offering. Like we can still offer all these services. It's more personalized as well and a better patient experience too, as you put out. So it's almost like trying to differentiate yourself kind of in the market.
for sure.
Yeah, no, that totally makes sense. And I guess, like, so how, when you're getting in with hospitals, are they kind of finding out about you guys? Is it just like making these connections with new hospitals?
Honestly, it's really our doctors' relationships with other
Yeah,
physicians. Like that's our best way in. And what we've noticed is I kind of have to leverage our doctors to talk to their colleagues to kind of make that connection.
yeah,
Once we get there, it's a lot better, but that's the biggest because, at the end of the day, the hospitals are all relying on the doctors. So the doctors have the biggest voice. Once they show their voice, then we easily get in and are able to talk to administration.
yeah. No, that totally makes sense because it's like they want to be able to talk to somebody that they can relate to, that kind of understands, like, okay, these are the challenges, kind of. This is what we're seeing, this is what we need help with, and they can kind of talk on that same playing field almost. Yeah. No, that definitely makes sense. And I guess, how have you kind of, over your time working in pathology, how have you kind of seen it evolving? And what do you kind of see for the future of the industry as a whole?
So I started, pre-COVID here. So
Yeah,
my second year is when we had the whole COVID dynamic change of healthcare.
yeah,
It is drastically changed. We went basically overnight from the pathologist having to sit at a desk at the hospital reading glass slides underneath a microscope to hey, you can go do that at home now because of COVID. So regulating bodies immediately authorized them to move their microscope, move their work anywhere that they wanted to read, versus before those things had to stay at a set location and they had to be approved by whatever regulating body.
Yeah.
So we saw that change, and then they pulled it back, but they also opened the door for digital pathology, which is there's two components. One, it's mainly digital, which is scanning all of the slides so that pathologists can read them on a computer and
Okay.
not glass. And then the second component of that is AI. So I'll talk a little bit about the first component. We have the capacity to get to about 95% digital right now at Vivid, meaning 95% of the slides we create are going to be on a computer. All our GYN pathology is digital right now.
Yeah.
It has algorithms reading it and pre-producing images so that our techs can see something that's abnormal or not and move on to the next case. Obviously, our doctors get the abnormal ones to do a full review.
Yeah.
So we have that capacity now. We haven't turned it on, as I mentioned, we went to Birmingham. So
Yeah.
we're using our capacity now to do everything for Birmingham. So everything out of Birmingham will come to us here in Pensacola. We're processing it, scanning it, and the doctor that's sitting at Birmingham is able to read it. So that's already the biggest advance there, is like you're not constrained to that location to process everything inside of a lab.
Yeah.
So we will eventually get to 100%. That's our goal. We'll get to 100% digital scans, which allows our doctors to read pretty much anywhere that they have access to our servers and those software programs.
Yeah. That's super cool.
It's pretty exciting. You know, it helps out a lot. It helps out turnaround times. It helps, not having to move glass slides to certain places because, like I said, we have subspecialty. So all of the derm slides go to the derm path. We
Yeah.
won't have to do that in the future. They will just log in and it'll be accessible from where they're working at in the hospital.
Yeah.
And then the second component is AI, which we already have a few algorithms we're testing. Basically, they go in and they see the skin and they look at the tissue and go ahead and give like a preemptive diagnosis or do preemptive markers or take measurements of how far certain things are apart in the cell, just typical things that our pathologists do on a regular basis that they'll do less of those and more of coming in saying, okay, here are my markers, it meets this criteria. That's good. Let me double check it. Okay, let me sign this case out. So we're looking to cut down time, mainly like breast reviews are biggest. It takes, right now it's taking anywhere from 20 to 45 minutes to review some of those cases. We can cut it down to 15.
Yeah.
So that's huge.
Yeah.
That's huge.
I feel like, yeah, a lot of just better efficiency really is like the main thing. Like you're using less time in a more efficient way. And so you're able to do more, but also with more efficiency and like less mistakes, probably even too. Like with something like AI, it's based off of that algorithm. And obviously, you still need a doctor to go in and like check it and everything. Like it's not gonna be foolproof, but I think that, yeah, just like really a lot more efficient model of kind of doing things.
Yeah, definitely. There's some preemptive studies going on now that are out there, and you can find them through the EWC, which is Executive War College. But there's some preemptive studies that some of those speakers are doing now where they're using AI agents that work hand in hand with the pathologists.
Okay.
And they're seeing error rates drop to like a 0.00001%.
Wow.
On reads. So we're talking about a pretty bulletproof system when you combine some AI technologies with the expertise of pathologists.
Yeah, no, that's so crazy, honestly. It's crazy because I mean, with anything there's human error, like you're going to have human error with driving, anything from driving to like writing an email, and now we have AI that can help us with so much of that and just making it cutting down on human error, but you still need a human to oversee it too, because like with something especially like pathology, it's very important to have a doctor who is trained in this specialty involved in it as well.
Yes, sir.
Yeah. Awesome. Well, cool. Well, tell everyone what is the best way to find Vivid Pathology online and learn more. And I will also include it in the show notes for easy access.
Yeah, so our website's vividpathology.com. You can learn about, we have all our doctors on the website. You can learn about them, what their subspecialties are. If you have other inquiries, you can email us at info@vividpathology.com. If you reach out, our team will get that email and can respond in any way.
Awesome. Cool. I'll put that in the show notes as well. I really, really appreciate you coming on and educating us a little bit more on vivid pathology and pathology in general. Thank you so much.
Thank you.